everyone! I'm here to discuss about Botox. Why Botox? Kasi until now, a lot of people actually still has a lot of fears with regards to having Botox treatment. That's understandable. That's why we are here actually to educate you guys on what Botox is and what it can do and ano yung ating mga restrictions when having Botox treatment. Unang-una kasi, ang Botox is just a simple 10-minute procedure. But prior to that, let me discuss about what Botox is. Botox is actually a protein. This protein actually is the one that signals the nerves that contract the muscle. So, ibig sabihin, when you do the Botox, it stops the nerves from signaling the muscle to contract. That's why, ang nangyayari, that's why when you inject Botox on particular areas of the face, like here on the crow's feet, the forehead lines, dito sa may glabellar area and forehead lines, what happens is, nire-relax niya yung mga muscles na yon. Thus, yung mga wrinkles, nababawasan, and a younger looking face or more youthful face after a treatment. Also, it's being used for cervical dystonia. In some ENT procedures pa nga, they inject Botox on the vocal cords. So, marami siyang medical purposes. Also, hyperhidrosis or excessive sweating, approved na rin yan. Actually, ang Botox is a brand, So, when you say parang yung refrigerator and Frigidaire, nakasanayan ng mga tao na buksan mo nga yung Frigidaire. But it's actually a refrigerator. A Frigidaire is the brand. So, Botox is actually a brand, And it's actually the first in the market, sila yung nauna to produce this botulinum toxin injections, So, iba-iba kasi I think now there's 3 or 4 na mga brands already from na botulinum toxin brands that are FDA approved, among them, there's this Portseomin, I'm not sure if there's another one right now, pero so far, yun yung mga alam natin, yung tatlong yon, So, kung ano yung brand na pipiliin, it's really up to the injector, for you, for the patient, and the injector to discuss, kung lalo na kung ano na yung nakasanayan ng inyong injector, So, unang-una is, ano yung mga indications niya? Just like I've said, for cosmetic purposes, yun ang pag-usapan natin, dito sa crow's feet, dito sa glabellar, yung may mga number 11 lines na yan, and dito sa forehead lines, ang contrary to what other people think, hindi ka na makaka-smile, hindi ka na makaka-frown. Actually, it depends on the injector, So, number 1, how do you choose an injector? Number 1, they should be experienced, Number 2, they should be trained, Or, kasi, like, as we do have trainings in anatomy, facial anatomy, that's very important. And of course, the safe techniques of injecting Botox, And of course, the years of experience. So, those are the things that you really have to take into consideration when choosing an injector. And of course, yung mga testimonials or yung mga referrals na nanggagaling or feedbacks from their existing patients. So with regards to brand, as I've said kanina, it depends talaga on the injector on what brand na he has to use. But be careful because there are a lot of mga counterfeit Botox, para rin yung syempre when you're buying a shoe, may iba-ibang brands yan. May high-end and may low-end or may counterfeit pa. So just be careful when choosing Botox treatment, especially when the price is too low. You really have to be careful, even in the same way with buying mga products, So you don't have to be afraid to ask the injector, ano ba yung brand na gagamitin mo, So dapat you have a right to ask that. Another thing is, sino pwedeng mag-Botox, Number 1 is, of course, yung merong mga visible lines or the lines that come out tuwing sila yung nagsasmile, nag-exaggerate, and nagpa-frown or nire-raise yung eyebrows. Particularly see a lot of forehead lines dun sa mga 40 and above who have already mga errors of refraction or yung lumalabo na yung mata who actually needs reading glasses. So they try to open their eyes like that. So kakaganon, nagiging lines. And when you don't correct that early on, pwedeng nagiging permanent yung lines na yon. So, nagkakaroon na yon ng mga permanent lines already, no? So, nakikita mo na yon. Even if you're not frowning, if you're not smiling, ando na, permanent na. And with that, you do pa rin Botox, but meron ng ibang procedure na dapat gawin doon to lessen those lines, like mga fractional lasers. Don't wait na umabot pa tayo na mas marami nang gagawin, no? As long as you're seeing already those lines, okay lang yon, no? Kasi iba-iba naman kasi. Some age faster because they're always under the sun. So, wala talagang hard and fast rule when it comes to age, as long as naiintindihan niya what she's undergoing and hindi siya underage, no? And hindi siya pregnant. And wala rin siyang allergies to Botox. Actually, the allergy to Botox is very, 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 very rare, no? In fact, with how many years that I've been injecting Botox, siguro mga, ang tagal na, 20 years na mga ganyan na, no? So, almost 20 years, no, na nag-i-inject na tayo, is isa pa lang ang nakita kong nag-allergy. When you are undergoing Botox, it's important to declare to the doctor kung ano yung mga treatments nyo in the next few days, no? Para alam ng yung mga dermatologist kung kailan yung right timing. Kasi minsan kasi, i-inject ka and then you will immediately go to the dentist, then you immediately have a facial. Bawal yon, no? So, during the Botox treatment, usually we put an anesthesia to numb the area, and then we put ice pa, and then after nun, then we inject the Botox, which just takes 10 or less than 10 minutes, no? Also, we can also inject that here, on the masseter area, and also here, dito sa mga neck bands, no? We do inject that also on the neck bands, yung mga matitigas na neck bands here, especially for older women, no? So, ginagawa rin po natin yan. It's important to get a post-treatment instruction, the do's and don'ts, no, after Botox. Because, you know, contrary to what other people think, they think that the Botox will migrate, no? Hindi po siya magma-migrate, no? It stays on its place, unless, no, within how many hours after the Botox, pinipress nyo. So, it's important not to press the area afterwards, no? So, hindi siya magmamigrate. And, contrary to what other people think, na you cannot smile after Botox, you cannot frown, you cannot raise your eyebrows, mas maganda nga po na ginagawa yon. Kasi the Botox actually mas nagpe-penetrate, or my studies that it stays deeper into the area that it needs to go during when you contract and when you frown and you're doing all these muscle contractions, no, after Botox or within an hour after Botox. It's important not to manipulate the area, not to press on the area within 3 hours after a Botox injection, no? There should be no facial treatments or no laser treatments after Botox injection for at least mga 1 week, no? Kasi yung mga laser sometimes, it's not because it will migrate, no? The thing is, we don't want the Botox to be heated so much, no? Masyadong mainitan na baka mawala yung effect nito. So, we don't want extreme temperatures muna. Within the next 5 to 7 days, no? Mga ganyan, or 7 days, yung iba 7, yung iba 10 days, yung iba 2 weeks pa, no? So, it depends on the clinic, no? But for me, I think it's 5 days and up, pwede na po yun, no? Tapos, it's important not to lie down or bend over within 4 hours, no, after injection. Usually, the results can be seen actually within 24 hours in some patients. In fact, for me, no, when I do Botox on myself, I already see results after 2 hours. Ganun kabilis. So, iba-iba po ang tao, no? So, within 24 hours, sometimes they see the results. Yung iba, they see it after 3 days. Yung iba, 5th, yung iba 7 days. But definitely on the 7th day, that's the maximum time that you will see the results of the Botox, no? With regards to exercise, no, it's better not to have any strenuous activity, mga within 24 hours, like yung mga mga jogging, no, yung mga jogging in place or yung mga jogging or extreme mga exercises, wala muna, no? Because we don't want that. Para lang masigurado natin na yung, because we want to avoid too much heat of the body, and also at the same time, we don't want na mag-exercise, baka matama-tamaan niyo po, no? Or madisgrasya or madapa kayo, no? So, yung mga madalas na kinakatakutan nila sa Botox is, I really understand why. Kasi we see a lot on social media about celebrities or mga people who hardly have any expression already because of Botox. Pero pwede naman pong maiwasan yon, no? Unang-una, the technique of the injector is important. Under that, the area where he's injecting, how deep he's injecting on particular areas, and of course, yung mata nung gumagawa, kung ano yung maganda. So that's important. Hindi lang yung science, but the art of injecting it. So the doctor should be able to determine which is bagay dun sa patient. We don't want eyebrows that look like bahay kubo, triangular, or eyebrows na ganon, na Jack Nicholson, no? So nakakatakot. And we don't want frozen face, no? That's why ang rule in doing Botox is to undertreat and then to just follow up and then just add if needed, no? So sometimes when we inject here, we ask the patient to come back after a week, because then we will need to see if we need to give a little few more units of Botox. So yon, I hope my discussion has helped you guys na medyo mabawasan yung kanilang fear, and we are here to help you make wise decisions for your skin and of course for your overall health and safety. Until next time, we are gonna discuss about my favorite treatment, dermal fillers.